Good morning. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So we were discussing about some of the common symptoms of a congenital cardiac problems, and we have already seen one full class for that. Now we will discuss about another important symptoms, which is a long-term effect, that is recurrent respiratory tract infection. Now, recurrent respiratory tract infections are quite common in congenital cardiac problems. A child with cardiac disease or congenital cardiac defects is always more prone to the recurrent respiratory tract infection, and it leads to growth failure. So a cardiac disorder will be always associated with a growth failure. Now, any child who is coming to you, just look into the height and weight and anthropometry and decide whether this is a case of growth failure. And if it is a growth failure, then so many causes are there to assess, but one of the causes that you should not forget is a congenital cardiac problem. Okay, so in case of the mitral stenosis, now what happens? There will be a cough and breathlessness, and there will be increased blood flow on exercise. One thing. Another one is if there is a VSD, and this is most common cause in case of TOF and all, tetralogy of the fallow, the VSD, presence of the VSD. So there is a shunt between the right ventricle and left ventricle, isn't it? So when the left ventricle contract, now what happens is blood is moving towards the right ventricle through the shunt. Okay, so there is a over collection of the blood in the right ventricle, over collection of the blood in the right ventricle. Now from the right ventricle, this blood has to be emptified by any way. So where it has to be emptified? It has to be emptified into the pulmonary trunk itself. So now pulmonary trunk is carrying this extra amount of the blood into the lungs, and lungs are now overflooded with the blood. Lungs are overflooded, and now what happens is edema in the vasculature of the pulmonary vasculature. There is edema in the vasculature of the lung. This leads to pulmonary hypertensions, persistent pulmonary hypertension, etc. But because of which, what happens is now blood is going to stagnate in the lower part of the lung. In the lower part of the lung, there is a stagnation of the blood, and there will be edema. Virtually, there is a pulmonary edema, and because of this, lung compliance will go down. The lung is not able to expand, not able to extend or expand, etc. So totally lung compliance will come down, and because of the lung compliance, the secretions which are present, the mucus secretion, etc., so they are not get cleared properly. Okay, so there is a decreased compliance, and there will be also stimulation of the cuff receptors, because of it there is also stimulation of the cuff receptors. So this actually leads to tachypnea and breathlessness in the child. This is the first part. But when this is continued, that means continuously baby is receiving extra amount of the blood to the lung, which is not required because of the shunt defect. The lung is overflooded with the edema, and as a result, the mucus secretions are not get collected, and the blood is also stagnated there. A stagnated blood is always act as a culture media. And in the meantime, because of the decreased compliance, the lung secretions are also not cleared, mucus secretions, etc. And that again gives a shelter for infection. So now this leads to increased chance of respiratory tract infection, especially lower respiratory tract infection, not upper respiratory tract, lower respiratory tract infection. So this is the major cause of recurrent respiratory tract infection in a child with a congenital cardiac disease. When such things occur very commonly, then definitely there will be growth failure. Now, cough due to the respiratory disorders will have, now I told that in case of cardiac problems also, congenital cardiac problems also, there will be cough. And the cough will be also there in case of respiratory problems also. Now it is very important for the pediatrician to differentiate between these two types of cough. Okay, cough due to respiratory disorders usually will have cough is more and less breathlessness. Most of the time, upper respiratory tract infections, etc., we will have the cough. But usually the cough is more and breathlessness is less, unless the child develops the pneumonia. And whatever the cough which comes there will be a wet sputum, and in between the child is normal, in between the cough. In between the cough episode, child is normal. Cough sometimes may be also because of CNS related problems. Okay. Now, cough may be also because of GERD. So we know how that we have already videos to explain all these things. Okay. But cough due to cardiac disorders, how to differentiate? What I am telling is cough may be because of respiratory problem, cough may be because of CNS problem, cough may be because of GIT problems, and cough may be also because of cardiac problems. Now we are only differentiating cardiac problems, cough of cardiac problems. In the respiratory problems, we know that, okay? So there will be cough is more, breathlessness is less. Okay, and in between the cough episodes the child is absolutely normal. Whereas in case of cardiac problems, in between the cough episodes the child is not normal, still child is tachypneic. Okay, so cough due to cardiac disorders, child is not normal in between. At least we will have, it will have some breathlessness in between, some breathlessness in between. Throughout he will not have the same problem. So this is how majorly we have to differentiate cough of the cardiac problems and cough of respiratory problems along with other symptoms. Okay, in case of respiratory problems, usually in between the cough child is normal, whereas in case of cardiac problems, throughout the day child is looking dull, and throughout the day the child is having some of the problems. One, in case of respiratory problems, the cough is more and breathlessness is less. But whereas in case of cardiac problems, cough is less significant, but breathlessness is more significant. So these are the two important aspects that we should know to differentiate between the cough of respiratory and cardiac lesion. Another important symptom related to the cardiac malformation or cardiac problem is palpitation. Palpitation. Awareness of one's own heartbeat is called as palpitation. We know that. How come an infant is able to identify the palpitation, isn't it? It's quite difficult, palpitation. So, or else he does, mother knows her child. See how a physician comes to know, pediatrician comes to know. By himself, child cannot say. So now mother has to say. You, most of the time mother says, मेरा बच्चे का जो है ये छाती जो है बहुत ज़्यादा एक्ट कर रहा है हड़बड़ा रहा है. So usually mother says like that. Practically, the awareness of one's own heartbeat is called as palpitation, but child cannot able to assume this. So mother has to assume it, and mother's assumption is like that. मुझे लगता है कि छाती बहुत ज़्यादा मूव हो रहा है, बहुत ज़्यादा फटफटा रहा है. So these are the mother's words. Now, what actually it suggests is the heart rate is more. Usually palpitation, when you talk, when the heart rate is more, you will have the palpitation, and heart workload is more, and there will be hyperdynamic circulation that leads to this particular palpitation. So indirectly it is the evidence of good left ventricular function actually. मतलब हार्ट अगर बहुत ज़्यादा बीट कर रहा है इसका मतलब है बहुत अच्छा गुड लेफ्ट वेंट्रिकुलर फंक्शन हो रहा है. बट वाई दैट heart is working more, that is because of VSD and such problems where there is collection of the blood. Okay, so although it indicates a good ventricular function, left ventricular function, as it is a part of the problem, okay, that is happening because of some problem, so we have to keep eye on that. Okay, so that's one of the important symptoms, that is palpitation. If you look into some of the physical signs, some of the most common physical signs in case of congenital cardiac problem is the heaving apex, sustained increased amplitude and duration. Okay, so that means very active, overactive precordial area. Precordial area is very active. Okay, there is heaving of the apex, and apex beat is clearly visible. Okay, and it is hyperdynamic. That suggests that left ventricular is working more. Left ventricle is working more, or even to some extent right ventricle is working more. Now there are different types of the apex beat which is happening in cardiac problems. Tapping apex means sustained and not forceful, touch and go type. Okay, another one is normal apex, so that is tapping and ill sustained. Another one is heaving apex means sustained with the increased amplitude and duration. This usually happens in the hyperdynamic circulation. Okay, so these are the three types of the. Now see, in case of congenital cardiac problems, definitely apex beats functions more. Okay, there will be overactive apex area will be there. Again, the subtypes are, it may be a heaving apex, it may be tapping apex, or it may be a normal apex. If it is heaving apex, sustained with the increased amplitude and duration, that means totally amplitude is more, and it is sustained continuously. Okay, and duration is also more. In case of tapping apex, it's coming and going. Okay, touch and go type. Normal apex, tapping and ill sustained. So these are some of the important findings for the physical signs. Some of the common investigations that we can suggest in case of congenital cardiac problem is a radiography of the chest, and then electrocardiogram, then echocardiogram, and then cardiac catheterization. So these are some of the common investigations that we can go. In the next class, we will continue the same. Thank you very much for your patience listening. Don't